Okay, hello and welcome everyone to this session on bridging the impact of COVID-19 on open education, in which myself, Abdallah Al-Khafaji, the liaison officer for medical education issues from IFMSA, will try to bring closer to the open education community the perspective of youth, medical students, and healthcare students. First of all, I would like to introduce you to my organization, which is IFMSA, the International Federation of Medical Students Associations. IFMSA is a federation that was founded in 1951. It is composed of 145 national member organizations from 134 countries. It is composed of 1.3 million students all over the world and is considered the world's largest student organization. IFMSA is recognized within the United Nations. The World Health Organization works closely with the World Federation for Medical Education, World Medical Association, UNESCO, and other education-related organizations, as well as we organize the largest medical exchange program in the world. Our motto is Think Global, Act Local. Our power comes from our national member organizations and our members worldwide. We are proud to include a diverse community of medical students from all 5 regions from all over the world. In our agenda for today's session, we will briefly mention how IFMSA investigated the impact of COVID-19 on medical education worldwide, as well as the medical education status amid the pandemic and what is the way forward, and open education and student-centeredness. First of all, let's look at the status quo at the moment. And since the last quarter of 2019, the world has been living in the new era of COVID-19 when everything got locked down, when the whole world changed, including education. Now, it's not a secret that education in all different fields in everywhere in the world probably got affected by or impacted by COVID-19. Now, the medical field and the healthcare field is not any different, yet there are simple things that could distinguish the situation there. In medical schools, medical students are the ones who are in close contact with the patients. They have rotations, they have courses in hospitals, in healthcare centers, who got severely affected by the situation. So IFMSA decided to study the status quo, and we decided to further go on with these 2 methodologies. The first one was the IFMSA tracking map to track the activity of medical schools' response to COVID-19, whether they are continuing their studies or they have been suspended, as well as the IFMSA global survey on the impact of COVID-19 on medical education, especially on terms of students' attitudes toward e-learning or the virtual education, as well as student-centeredness and roles in e-learning beyond the pandemic. So here is a screenshot of the IFMSA tracking map that shows a lot of medical schools around the world. And thanks to our global network of 134 countries, we received responses from 103 countries, and 2,761 medical schools were reported only in the period between April 1st and April 20th, in which 2,640 medical schools from 95 countries have completely suspended their curriculum delivery in physical settings. Some of them needed extra time to absorb the shock and to adapt to the new era of COVID-19. And honestly, preparedness around the world to this new norm was not fully complete. 1,120 medical schools in 66 countries succeeded in providing online education as well. Here are the results from the IFMSA survey, in which we have concluded through the IFMSA report on the impact of COVID-19 on medical education worldwide, in which you can access through the link in the barcode. And don't worry, you will have the slides shared on Sched after the session. Among the results that we have received is that online teaching and e-learning is now the new norm in medical education and healthcare education worldwide. Different teaching methodologies have been followed, in which online lectures were the most dominant in probably all the schools over the world. Other methodologies were also common, like small group teaching, where medical schools and faculties would limit the number of students in order to minimize the contact with the patients and therefore minimize the contact with the virus. But still, online lectures are the safest option always for medical students and healthcare students. So a lot of questions will arise after this sudden transition from the physical settings, from the usual education to the e-learning to the virtual education. A lot of challenges, a lot of questions would ask themselves, like the efficient alternatives of the physical settings. For example, are the teachers and educators ready to provide the content virtually? That's a global issue where, for example, in my medical school where I come from, I have teachers, professors who have huge knowledge, huge experience, but they lack technological experience and they have faced a lot of difficulties in dealing with the educational platforms. Also, the communication, which is vital in so many fields, but in the healthcare field, for example, communication with the tutor, communication with the doctor, with the physician, with other members of the team, for example, the nurses, as well as the communication with the patients themselves, was severely affected and at so many occasions almost eliminated, which is another issue, as well as, for example, the practical and clinical education. In a lot of fields, practical knowledge is necessary to acquire the skills you need to practice that specific career or job. And the medical slash healthcare uh, field is definitely one of those. And that has been severely impacted due to the prohibition of contact with patients in hospitals that are in so many countries full of COVID-19 patients and cases. So arising from that, do we expect that the quality of the doctors and health workers produced from those health schools and medical schools will be impacted, and how? As well as, will the new norm of education prepare us as health workforce in the future to face the COVID-30 hypothetical pandemic, if that was the case? So all those are very interesting questions, and which adds to the challenges of the virtual and e-learning platforms is that um, something that Aaron Watson et al. And have posted in the Health Information and Libraries Journal in their study, which stated that on average, ebooks cost 2.2 times more than their print equivalents, which adds to the cost and the cost effectiveness of the medical education and healthcare education. In addition to that, if we look on a larger scale on the health workforce at the moment, we are short of 15 million healthcare workers around the world. We should reach 80 million healthcare workers by 2030, but we will only have 65 million. So we already have a shortage of health workers. And with COVID-19, Marsha Frillick posted in Medscape Medical News on September 29th, 2020, that COVID-19 has killed more than 1,700 healthcare workers in the United States alone, not taking into account the number of health workers who got diseased and who got infected and couldn't normally pursue their jobs and couldn't serve in hospitals and health care centers, which additionally impacted the situation of the health workforce crisis. So all this looks like if we have a snowball effect, everything is collapsing. It gets bigger and bigger and until we reach to the no going back point, until everything is destroyed. which is something that nobody hopes for, and this would be very tragic. So among other institutions and organizations, IFMSA, as the largest student organization in the world, as the official representative of medical students in so many institutions like the UN and the WHO, we decided to act, and we decided to act now. And uh, hereby, I will present to you some of the things that open education was part of IFMSA's strategy in dealing with the new norm. First of all, meaningful youth participation is IFMSA's core value. This is something that is the basis of our work in every single area, in medical education, in human rights, in sexual and reproductive health and rights, in public health and research, in global health, etc., etc. IFMSA always works to promote meaningful youth participation, and open education is no exception. So we definitely call all the open education community members, all the organizations who are concerned to always include, involve, engage youth within their institutions, within their plans and strategies for so many reasons. Among them is that technology, as you know, young people are more familiar with technological advancements. They are more capable of innovating new ways in the delivery of content, in the accessibility, and the equity of distribution of content. As we have seen, so many platforms have been arising throughout the previous period, throughout the 10 or 11 past months that have helped actually the whole humanity to deal with the pandemic and the lockdown. Another reason is that youth always bring new perspectives to the table. And even though that older people are always experienced, are always skillful, always are have their own way, but youth will always bring something new. They would always make bold suggestions, and that is something we need because the world now more than ever needs more rough changes, as well as the motive of medical students. Medical students and youth in general are very motivated to serve, to make impact, to change the situation, and to transform their education into open education. One of the things that we have done in IFMSA is we have created our own resource center, which basically collects every new COVID-19 resource that we could share with our members. So we have created this resource center of open educational resources because we thought that for medical students to be familiar with open education, they need to get open education on the reason why they need open education, which is COVID-19. Another solution that we have proceeded with is that we have partnered throughout the previous year with different diverse educational platforms that provide open education. In the picture, you can see some of them. And even though some of them are actually paid and they require financial requirements, but we have advocated for medical students access, at least for the period of the pandemic, at least for the period of lockdown. A lot of those platforms were generous enough to provide us and medical students worldwide with free access for 3, 4, 6 months. And a lot of beneficiaries from all over the world got access to those precious platforms. One example that we have done, and actually a good practice we would consider, that we have partnered with an organization called Scholar RX to create this platform that is called RX Bricks. So the bricks are basically educational units where anyone can create open educational resources, post them, share them with everyone in the world. Any medical student or healthcare student can access the website and can actually read, review, and suggest feedback and input to those educational resources. And we try to always keep them updated. and always following the most recent guidelines. So here is, for example, on the right, you can see a picture of how a brick looks like. And here you can see that the University of Dundee have actually worked with us, and they have participated in um, creating their own bricks. And they are shared with basically all the students from all over the world, not only universities or institutions or organizations, but also individuals. For example, on the left, you can see here that a medical doctor that is also a professor in a university have created their own bricks and shared them with their students, and they're accessible by all students all over the world, as well as promoting different educational resources on topics that are always neglected in the usual curricula and the usual setting of schools, in healthcare schools, for example. And I think this is a step forward for education, and that we were able to produce content that is already lacking in the usual curriculum. So I think that's an advancement for open education and for virtual education and e-learning. Another mean of content that we have is our national member organizations. As I said, we have a huge network of 145 national member organizations distributed in 134. Those MMOs are the power of IFMSA. They work nationally, locally. They bring the international advancements back home and try to implement, integrate, and align to their local or national contexts. So for example, this is one of these achievements, one of these open educational resources that was created by one of our NMOs, which is called LUMSIC, the Lebanese Medical Students International Committee, which is an e-learning manual that provides students with basically every platform that is open and provides open educational resources, as well as some tips for students on how to proceed and advance their education virtually. So there are many potential solutions for the current status quo, for the current crisis in the age and the era of COVID-19. Open education is certainly one of them. In IFMSA, we have done some humble steps in order to be a contributive part of this global community. We seek to do more. Even though this is not enough, we call all the open education community members, all the organizations that are concerned, to support students worldwide, to be hand in hand with students in order uh, to prepare humanity for the new norm, to make education more accessible, and especially in the fields of healthcare and medicine. I think now we can open the floor for questions for the last 5 minutes. So I would like to receive some questions from the audience. If you have any, please raise your hand or send something in the chat, and I'll be glad to receive that. Okay, so there is a question from Philip that is your work mainly with med school level courses, or do you also have resources for nursing programs? Actually, IFMSA is mainly concerned with medical students, although we work closely with nursing students. We are a member of the World Health Students Alliance, in which hear our voices with other
So it looks like we've momentarily lost our presenter here. So
nursing student organizations.
Oh, sorry. Could you repeat your response because we lost you just for a moment?
Yes, absolutely. I was answering to Philip's question, and IFMSA is mainly concerned with medical students' education, although we work very closely with other members of healthcare students community worldwide. We are members of the World Healthcare Students Alliance, in which we share our voices with pharmacy students, dental students, nursing students, and chiropractor students. And we all work together to promote interprofessional education and collaboration. We have with nursing students and the current in the past 2 years, and there are definitely a lot of resources that we can share together at the end of the session. You can always email me at alami@ifmc.org and we can continue this conversation. Are you using any of the resources from University of Cape Town's medical school? So basically, our national member organization from South Africa has been newly established in the past year. They have been definitely working with the University of Cape Town and in their medical school. Uh, in in uh, in Africa in general, a lot of movements, a lot of student movements have been established working together with the international IFMSA to basically promote open education, to promote access to educational materials in the time of COVID. So yes, we have definitely been working with the universities and the medical schools in all Africa, not just in South Africa. I think that we have more questions. I am not in the medical field, but I appreciate this so much. Thank you so much, Maha. Thank you. We already appreciate your presence and your support. I think we have an additional minute for more questions. If not, you are always welcome to email me at lme@ifmsa.org. We can continue the conversation there, and we welcome any kind of collaboration.
Okay, so we are at time for this session. I'm going to go ahead and stop the recording. Let's see.